Social update UG, how to prevent and manage red eyes after outbreak. Kakati nno engeri y'okubeera nga weewala n'okujjanjaba n'okwawula obutafuna maaso mamyufu because waliwo outbreak in Kampala. There is an outbreak in Kampala for red eyes, but this is how you can prevent and manage the red eyes outbreak. What you need to know is that the health ministry says the outbreak is not only in Kampala but also in prison facilities in other districts. With more than 950 cases of infection with a contagious eye disease, conjunctivitis (red eyes) registered in schools and prisons, health experts have prescribed a raft of measures to prevent and manage the disease. Dr. Daniel Chabayinze, the Director of Public Health at the Health Ministry, said yesterday in Kampala that the disease presents with many signs and symptoms. The patients who say there is irritation of the eye, they don't want to look in bright light, the eyes pain, and there is discharge, he noted. When the clinicians examine, they will find that the eye is inflamed. The conjunctiva, which is the lining inside of the eyelids and covers of the sclera, the white of the eye, is all red with increased blood flow. This can be a result of rubbing the eyes, he added. According to health experts, the disease can be caused by a virus, bacteria, or environmental pollutants. Dr. Chabayinze said their scientists are still doing tests to determine the actual cause of the outbreak in Kampala and prison facilities. According to information from the health ministry, viral conjunctivitis, the most common form, is highly contagious and can spread from person to person through direct contact, sharing of personal items such as towels or pillowcases, facial contact, or sharing of eye drops or eyeglasses. We shall test a few samples and we shall be able to tell whether it is bacterial or viral. Other things can also cause red eyes: allergens, dust, smoke, and chemicals. We need to prevent it from spreading by doing what we are told and what we told people during COVID. Dr. Chabayinze said the outbreak was first announced by Kampala Capital City Authority on March 13th. In their notice, the authority, without revealing figures, said cases have already been reported in some of our schools and educational institutions. Now, in a statement on Thursday afternoon, the health ministry said the outbreak is not only in Kampala but also in prison facilities in other districts. So the outbreak is spreading to other districts in prisons. The outbreak has been identified in several schools in the capital city and 8 prison facilities in the country. The affected divisions within the Kampala district are Nakawa and Rubaga. The affected prisons include Luzira Upper Prison, Makisonbe Prison, Kasanda Prison, Kaweri Prison, Lira Main Prison, Erut Prison, Padar Prison, and Kampala Remand Prison, the statement read. The ministry also said as of March 13th, a total of 954 cumulative cases were registered with an incidence of 353. Joint surveillance efforts between the Kampala City Council Authority and Ministry of Health teams are actively underway. So far, a total of 790 cases cumulatively have been diagnosed in the affected prison facilities, of which 711 have been declared as recovered, giving a recovery rate of 90%. The incident cases are mainly admitted as new inmates by police who initiate the cascade of in-custody transmission, the statement read. The ministry also revealed that the contagious period when one can spread the disease lies within the first 10 to 12 days The infection can last up to 3 weeks. The ministry, in the statement, urged the public to adhere to the following preventive measures, which include maintaining high sanitization standards and washing hands frequently with clean water and soap. The ministry also advised people to avoid direct contact with the infected individuals, particularly touching the eyes and shaking hands, and refrain from sharing items with infected persons. Ebiri mu Kampala, okukwata ku bantu, minimize handshakes for now. Yeah, otherwise we can beat this. It's not big, it can even go without visiting any hospital. Yeah, don't forget to subscribe, share, and hit that bell button. Peace.